Hello everybody. With all excitement, I welcome you back to the Doctor's Lounge. Today, we have Dr. Losig on the spotlight. He is here to take us on a journey into our eyes. He wants to enlighten us about what makes us see what we see. Also, to give us some information about common conditions that can impair our vision. Hang on there as we set the ball rolling.
Thanks, Dr. Mercy. Let's begin. Our eyes are the vital organs in our body that enables us to see and recognize people, places, objects, etc. They are located within the eye socket, which serves as a protective housing for its delicate structures. These delicate structures include the conjunctiva, the sclera, the cornea, the uvea, the crystalline lens, the aqueous and vitreous humor, and the retina. We will be taking a closer look at these structures today.
Okay.
So, the conjunctiva, I think, may be a good structure to start with.
Agreed.
The conjunctiva is a clear, thin membrane that covers the white part of the eye and extends to the insides of the eyelids. There are two segments. One which covers the white part of the eye, which is also known as the bulbar conjunctiva. The other portion called the palpebral conjunctiva, which covers the inner surface of both the upper and the lower eyelids. The primary functions of the conjunctiva include the following. 1. It helps to keep the front surface of the eye moist and adequately lubricated. 2. It keeps the inner surface of the eyelids moist and lubricated so they can open and close easily without friction or causing eye irritation. 3. It protects the eye from dust, debris, and microorganisms.
Okay, go on.
There are a number of conditions that can affect the conjunctiva. Let's take a look at a few. A very common condition is called conjunctivitis.
If I remember clearly, it's also known as pink eye.
Yes, you're right. In more technical terms, it is an inflammation of the conjunctiva. And there are three types. The first is viral conjunctivitis. This is caused by a viral infection of the conjunctival membrane. This type is highly contagious and can be transmitted from one person to another by coughing and sneezing. In addition to the eye being pink, one can develop watery, itchy, and increased eye sensitivity to light. This viral infection would usually run its course over a period of several days and no medical treatment is often required. The second type is bacterial conjunctivitis. As the name implies, this is caused by a bacterial microorganism. One or both eyes can be affected. Additional eye symptoms include a sticky, yellow, or greenish-yellow eye discharge. It's also highly contagious, usually by direct contact with infected hands or items that have touched the eye. This type of conjunctivitis can cause serious damage to the eye if left untreated. Antibiotic eye drops or ointments would usually be prescribed by your doctor to treat this type of conjunctivitis. The third type is called allergic conjunctivitis. It is caused by exposure of the eye to irritants such as pollen, dust, or animal dander. Allergic conjunctivitis may be seasonal or may occur all year round, depending on the irritant that is prevalent during that particular season and in that geographical area. Additional symptoms include watery, burning, itchy eyes, which are often accompanied by a stuffy, runny nose and increased light sensitivity. Allergic conjunctivitis affects both eyes, but this type of pink eye is not contagious. Allergic medications can often be prescribed to prevent or shorten bouts of allergic conjunctivitis.
Wow, 2 questions. 1. How can I prevent my eyes from contracting all of these conjunctivitis? 2. In cases where one already has it, how can the spread from one person to another be limited?
Yeah, preventive tips include the following. 1. Try as much as possible to cover your nose and mouth with your elbow when coughing and sneezing. 2. Avoid rubbing or touching your eyes, especially with unwashed hands. 3. Wash your hands frequently with soap and water, especially when at public places such as school, market, banks, etc. Alternatively, keep a hand sanitizer nearby and use it frequently if water and soap are not readily available. 4. As much as possible, avoid sharing personal items such as hand towels, handkerchiefs, or tissue paper. 5. Ensure you constantly clean surfaces that are usually being touched, such as tabletops, bathroom surfaces, countertops, door handles, shared phones, etc., with an antiseptic solution. 6. If you use contact lenses, follow your doctor's instructions for lens care and replacement. Before using the shower, remember to remove your contact lens to avoid trapping bacteria in between your eyes and the lenses. 7. Before swimming, wear swim goggles to protect your eyes from bacteria and other microorganisms in the water that can cause conjunctivitis. Lastly, if you suffer from seasonal allergies, ask your doctor what can be done to minimize your symptoms before they begin. Also, avoid close contact with pets or substances that have been prior identified to cause allergies specific to you. Okay, moving away from conjunctivitis, other conditions that could affect the conjunctiva include but are not limited to the following. Conjunctival cyst. This is a thin-walled clear sac in the conjunctiva that contains clear fluid. Usually, it causes tearing and eye discomfort. It often results from inflammation, trauma or surgery. Lubricating eye drops and/or surgical excision may be required to remove it. Subconjunctival hemorrhage. This is bleeding from a small blood vessel beneath the conjunctival membrane which usually appears bright red. Mostly, it occurs after a sudden or severe sneeze or cough, trauma, surgery, or even after rubbing one's eye vigorously. It's a harmless condition that often requires no specific treatment and usually disappears within 2 weeks. Conjunctival lymphoma. This is a tumor of the conjunctiva that usually appears as a salmon pink, fleshy patch. They are typically hidden behind the eyelids and are also painless. Conjunctival hemangioma. This is a rare, benign or non-cancerous tumor of tiny blood vessels that creates a red, blood-filled sac in the conjunctiva. Lastly, conjunctival melanoma, which is a rare, but fatal malignant tumor of the conjunctiva. It could appear as a raised painless pigmented or non-pigmented lesion in the eye.
Wow, this is quite a piece. In essence, once you notice anything strange in your eye, whether painful or not, it's best to hurry to the optometrist or ophthalmologist.
That's absolutely correct. So, moving on. The next structure we want to consider is
the cornea. Interesting.
Yes, it is the clear structure situated at the front surface of the eye. It lies directly in front of the iris and the pupil. If viewed from the front of the eye, it has a wider horizontal diameter than its vertical diameter. However, when viewed from behind, the cornea appears circular with a uniform diameter. Microscopically, the cornea has 5 layers, namely, the corneal epithelium, the Bowman's layer, the corneal stroma, the Descemet's membrane, and the corneal endothelium.
Oops, that's cool.
The clear cornea allows the passage of light into the eye for vision. However, more importantly, it is responsible for approximately 65 to 75% of the refractive or focusing power of the eye. The remainder is provided by the crystalline lens, which is located behind the pupil. This makes the cornea a vital structure in our ability to see things. Most refractive errors, including short-sightedness, long-sightedness, and astigmatism, are due to a less than optimal curvature or symmetry of the cornea.
Okay, can you enlighten us about some conditions that are associated with the cornea?
Oh yeah. Let's take a look at arcus senilis. Arcus senilis presents as a white, light gray, or bluish ring around the edge of the cornea. It is made of fatty substances, mostly cholesterol. It usually begins as a short arc of color along the top and bottom of the cornea. Eventually, these arcs may connect and make a complete ring around the cornea. It is a condition that tends to occur in older adults, however, it could be noticed in individuals of all ages, including infants. Vision is usually not affected and treatment is often not required. However, a visit to your doctor could be beneficial in detecting any possible causes that can have other health implications. Another common condition is called corneal abrasion.
Is it the scratched cornea or scratched eye?
That's correct. It is one of the most common eye injuries that causes a disruption of the protective outer layer of the cornea, which is the corneal epithelium, thus increasing one's risk of a serious eye infection. Anything that makes contact with the surface of your eye can lead to a scratched cornea, such as sand, tree branches, paper, a finger, makeup brushes, etc. A scratched cornea would give you symptoms such as eye pain, a gritty sensation in the eye, increase in sensitivity to light, twitching of the eye, and headache. Now, if you've got something or you feel like something entered into your eye, do not rub your eye. Instead, you can attempt to flush it with clean water, and visit your eye doctor as soon as possible. In addition, always wear safety glasses or protective goggles in work environments that have airborne debris, particularly in welding environments. They should also be used when doing yard work, using power tools, and while playing sports. Also, if you wear contact lenses, always follow your doctor's instructions regarding how to wear them, when to discard them, and the proper contact lens care solution to use. Moving forward, I want to hinge a little on corneal ulcer. A corneal ulcer is a serious abscess-like infection of the cornea that can lead to significant eye pain, scarring, and loss of vision. It typically presents as a painful, red eye, with mild to severe eye discharge and reduced vision. Most cases of corneal ulcerations are due to a bacterial infection that invades the cornea, often following injury, trauma, or any other damage to the eye. Besides bacterial infections, other causes of corneal ulcers are fungi, causing fungal keratitis, parasites for example acanthamoeba keratitis, and viruses such as ocular herpes. Dry eyes, eye allergies, widespread infections, immune system disorders and inflammatory diseases such as multiple sclerosis and psoriasis also can lead to corneal ulcers. If you are a contact lens wearer, you can increase your chances of avoiding a corneal ulcer by washing your hands before handling your lens, using the appropriate solution for disinfecting your lens, removing your lens before swimming, removing your lens before going to bed at night, renewing your lens as it when due, and finally, visiting your ophthalmologist regularly. It is important to stress that once you suspect a corneal ulcer, see your eye doctor immediately. Otherwise, untreated corneal ulcers can lead to severe loss of vision and even loss of the entire eye. A corneal transplant may be inevitable in some cases of corneal ulcerations.
Wow, thanks Dr. Losig. So can we talk a bit about the sclera?
Oh yes, the sclera. The sclera is the white part of our eyes. Structurally, it surrounds the cornea and forms more than 80% of the surface area of the eyeball. The sclera is composed of dense connective tissue and is continuous with the stroma layer of the cornea. The junction between the white sclera and the clear cornea is called the limbus. There is another structure I want to point out, which is a thin layer of tissue that lies over the sclera. It is called the episclera. The sclera, along with the intraocular pressure of the eye, very importantly maintains the shape of the eyeball. Secondly, the tough, fibrous nature of the sclera serves to protect the eye from serious damage such as laceration or rupture resulting from external trauma. In addition, the sclera also provides a sturdy attachment for the muscles that control eye movement. Here are some disease conditions associated with the sclera.
All right.
Sclerolicterus, also known as yellow eyes or jaundice, occurs whenever the sclera is stained by a pigment called bilirubin. It usually signifies an underlying condition which ranges from a rapid breakdown of red blood cells, to liver diseases, inflammation or cancer of the pancreas, obstruction of the gallbladder by gallstones, sickle cell anemia, etc. Episcleritis is an inflammation of the episclera. It is a common condition that causes the eye to look red and irritated. It also may cause tearing of the eye and a gritty, hot, or prickly sensation. Most episodes of episcleritis resolve on their own without treatment within a few weeks. Scleritis, on the other hand, is an inflammation of both the episclera and the underlying sclera. It is a more serious condition. Symptoms include moderate to marked eye pain, redness, tearing, and increased sensitivity of the eye to light. If not treated promptly, can lead to loss of vision and permanent damage to the eye.
Okay, got a grasp of the sclera now.
Now, going forward. Just behind the cornea is a fluid-filled space called the anterior chamber. In the fluid that fills this chamber is called the aqueous humor. The aqueous humor is a thin transparent fluid similar to the blood plasma. It is made up of 99.9% water and the other 0.1% consists of sugars, vitamins, proteins and other nutrients. This fluid plays an essential role in the health of the eye as it helps to nourish the cornea and the crystalline lens by supplying amino acids, glucose and other nutrients. Another major function of the aqueous humor is that it maintains the intraocular pressure of the eye. Continuous production of aqueous humor in the appropriate amounts is very critical to the eye's shape, size and the quality of image it produces.
That reminds me of glaucoma.
Yes, glaucoma could develop when the pressure inside the eye is more than normal and in most cases, an imbalance in the production and drainage of the aqueous humor from the anterior chamber results in this condition. Generally, it refers to a group of eye disorders that lead to progressive and gradual damage to the optic nerve. The optic nerve is the nerve that connects the eye to the brain. Glaucoma is the second leading cause of blindness in the U.S. In the most common form of glaucoma, that is primary open-angle glaucoma, the fluid pressure in the eye increases gradually, leading to a slow progression of the disease. Initially, the side or peripheral vision is lost, and then there is a gradual affectation of the central vision. Ultimately, it results in blindness if left untreated. A less common type of glaucoma, which is acute angle closure glaucoma, usually occurs abruptly due to a rapid increase in the pressure within the eye. An individual may experience severe eye pain, nausea, redness, seeing halos or colored rings around lights and blurred vision. This is usually an eye emergency in which severe vision loss could occur quickly. Although it is usually associated with an increase in the fluid pressure in the eye, the exact cause of glaucoma is unknown.
So, how can it be prevented?
Really, there isn't any way to prevent it. However, there are some steps that can be taken to lower your risk of eye damage. This includes going for regular eye examinations. Once it is detected early enough, treatment can be started to prevent or slow down further loss of vision. In addition, once you detect any of the above symptoms earlier mentioned, it is important to see your eye doctor immediately. For individuals who have a family history of glaucoma, it is also important to visit the ophthalmologist on a regular basis. It is also important to note that vision already lost to glaucoma cannot be restored, hence the need for early detection and treatment. Treatment in the form of medications or surgery can help to slow down or prevent further loss of vision.
Wow, very interesting.
At this point, let's take a quick look at the uvea. The uvea is the pigmented middle layer of the eyeball, which consists of three segments, namely, the iris, the ciliary body, and the choroid.
Of course.
Let's look at each of the segments closely. The iris is a flat, thin, ring-shaped membrane located just behind the cornea and in front of the crystalline lens. It has an adjustable circular opening in its center called the pupil. The color of our eyes is determined by the amount of pigment in the iris. Together with the pupil, the iris is responsible for regulating the amount of light that gets into the eye. When there is too much light, one muscle of the iris moves to constrict or reduce the diameter of the pupil. However, when it is dark or there is little light, another muscle of the iris acts to dilate or widen the pupil. These are involuntary responses controlled by the brain. The second part of the uvea, the ciliary body, surrounds the iris and is located behind the opaque sclera. Functionally, it holds the lens of the eye in place by a network of tiny ligaments called ciliary zonules or zonules of Zinn. Also, the ciliary body is responsible for the secretion of the clear aqueous humor that fills the anterior chamber of the eye. Lastly, it contains the ciliary muscle, which changes the shape of the lens when the eye focuses on a near object in a process called accommodation. The posterior or back portion of the uvea is the choroid, which is sandwiched between the sclera and the retina at the back of the eye. It contains numerous tiny blood vessels and has the vital role of nourishing the retina.
So what can go wrong with the uvea?
I was just about getting to that. An inflammation of the uvea is called uveitis. When this inflammation involves only the iris or both the iris and the ciliary body, it is called anterior uveitis. When it involves only the ciliary body, it is intermediate uveitis. Posterior uveitis is an inflammatory involvement of the choroid. However, when this inflammation involves the three parts of the uvea, then it is called panuveitis or diffuse uveitis. Causes of uveitis include eye injury, infections, inflammatory diseases, exposure to toxic chemicals, such as pesticides, and cigarette smoke. Symptoms of anterior uveitis include increased sensitivity to light, decreased visual acuity, eye pain, and red eyes. Intermediate and posterior uveitis usually are painless, however one could experience blurred vision and eye floaters, which are spots, flecks, specks, or cobwebs that drift aimlessly around one's field of vision. Complications of uveitis include clouding of the cornea, cataracts, glaucoma, swelling of the retina, or retinal detachment. These complications can result in permanent loss of vision. The treatment for uveitis ranges from corticosteroid eye drops, oral steroid medications, immunosuppressant therapy to corticosteroid implants surgically inserted into the eye. Another condition involving the iris is what is called synechia. This is when parts of the iris adhere to the back surface of the cornea or to the front surface of the lens. It can be caused by trauma to the eye or inflammation of the iris. This condition is particularly serious because it can lead to certain types of glaucoma. Iris coloboma is a congenital disorder where a portion of the iris tissue is missing, causing a keyhole, or cat eye, appearance of the pupil. This can cause blurred vision, decreased visual acuity, double vision, and ghost images. Uveal melanoma is a cancerous growth within the iris, ciliary body, or choroid. These tumors develop in pigment cells called melanocytes located within the uvea. Uveal melanomas are the most common type of cancers inside the eye and can metastasize to other parts of the body. There are treatment options, but in some cases, removal of the entire eye may be necessary via a procedure called enucleation. It is important to emphasize on the importance of routine eye examinations, which can pick early signs of melanoma or any other serious eye condition. Early treatment may help to preserve your eyesight in the long run. Another vital part of the eye is the pupil. This is the aperture at the center of the iris. Together with the iris, the pupil controls how much light enters into the eye. Using the analogy of a camera, the pupil is aperture of the eye, while the iris is the diaphragm that controls the size of the aperture. In low light or dark environments, the pupils dilate so more light can reach the retina to improve vision. However, in bright environments, the pupils constrict so less light enters the eye. This is so because too much light can cause glare, discomfort, and may even damage the lens and retina. In addition to being affected by light, the pupils normally constrict whenever you focus your eyes on a near object. This is called the accommodative pupillary response. Generally, the normal size of the pupils in adults ranges from 2 to 4 mm in diameter in bright light to 4 to 8 mm in the dark. Typically, the pupils appear perfectly round in shape, and black in color. This dark color is because whenever light passes through the pupil, it is absorbed by the retina and is not reflected back. In cases when the pupil appears to have a cloudy, pale or white color, this is because the lens which is located at the back of the pupil has become opaque due to the formation of a cataract.
Okay. Could the pupil be affected by any disease condition in any way?
Of course. Anisocoria is a condition in which the pupil of one eye differs in size from the pupil of the other eye. It could be physiological, congenital, or caused by several factors and disease entities. About 20% of individuals have physiologic anisocoria. In these subset of cases, there is usually no association with any underlying medical condition. Typically, in physiologic anisocoria, the difference in pupil size between the two eyes does not exceed 1 mm. Causes of anisocoria include the following. Horner's syndrome. This refers to a disruption of a nerve pathway from the brain to the face and eye on one side of the body. It typically results in a decreased pupil size, a drooping eyelid, and decreased sweating on the affected side of the face. Usually, it is caused by a stroke, tumor, or spinal cord injury. Horner's syndrome may be noticed in an infant. This is known as congenital Horner's syndrome. In some cases, it could result from neck trauma during birth, while in others there isn't any apparent cause. Mechanical anisocoria. This occurs due to direct trauma to the eye surgery, uveitis, angle closure glaucoma, etc. Atotonic pupil. This is usually an isolated benign entity affecting one eye. It is characterized by poor pupillary response to light but brisk response to a near object. It however takes longer to redilate after fixation to a near object. Oculomotor nerve palsy. This is an eye condition resulting from damage to the third cranial nerve or one of its branches. This is the nerve that innervates the muscles that control eye movement. It is also responsible for pupillary constriction. Damage to or compression of this nerve results in restriction in eye movements of the affected eye, drooping of the eyelid, and dilation of the pupil. It could be caused by traumatic brain injury, brain tumors, bleeding within the brain, diseases affecting the nerves, etc. Lastly, certain eye medications used for various purposes may induce anisocoria. Generally, an individual with unequal pupil size may experience blurred vision, double vision, loss of vision, headache, nausea, and other symptoms associated with the underlying cause. Also, treatment depends on the underlying condition. However, if any of the above symptoms are noticed, report such to your ophthalmologist immediately.
Alright, can we talk about the crystalline lens?
Oh yes. The crystalline lens is a transparent biconvex structure in the eye which along with the cornea refracts light rays and focuses them on the retina. By adjusting its shape, the lens focuses on objects at various distances, thereby producing sharp images of different objects on the retina. It is located behind the pupil and in front of the vitreous body. Also, it is suspended in position by the zonules of Zinn, which consists of delicate yet strong fibers that support and attach it to the ciliary body. The refractive power of the crystalline lens, which is the degree to which it converges or diverges rays of light, is roughly 1/3 of the eye's total power, the other 2/3 being contributed by the cornea. One very common condition affecting the lens is cataract. Cataract is simply the clouding of the eye's natural lens. It is the most common cause of loss of vision in people about 40 years of age and is the principal cause of blindness in the world. There are different types of cataract. Subcapsular cataract. This type of cataract begins as a small opaque or cloudy area at the back of the lens. People with diabetes, extreme nearsightedness, or those taking high doses of steroid medications have a greater risk of developing a subcapsular cataract. Nuclear cataract. This is the most common type of age-related cataract caused primarily by hardening and yellowing of the lens over time. It forms at the nucleus or central portion of the lens. Cortical cataract. This is characterized by white, wedge-like opacities that start in the periphery of the lens and work their way to the center in a spoke-like fashion. This type of cataract occurs in the lens cortex, which is the part of the lens that surrounds the central nucleus. People with diabetes are at risk of developing cortical cataracts. Congenital cataracts. These are usually diagnosed at birth and are usually associated with some ocular abnormalities, chromosomal anomalies, infectious diseases, amongst other causes. Cataracts cause blurred vision, which is like looking through a foggy window. It also causes increased sensitivity to light in the form of glares and halos when exposed to bright light. Double vision may also occur. Gradually, impairment in vision progresses, eventually leading to blindness. It isn't exactly known why the crystalline lens changes as we age, however, researchers worldwide have identified factors that may be associated with the development of cataracts. These include ultraviolet radiation, diabetes, hypertension, obesity, smoking, prolonged use of some drugs, for example corticosteroid medications, previous eye injury, inflammation or surgery. In addition, a family history of cataract, significant alcohol consumption, exposure to radiation therapy may increase one's risk for developing cataracts.
What can be done to prevent the development of cataracts in the eye?
Well, it is still a debate whether or not it can be prevented. However, there are still some things you can do to reduce your risk of developing cataracts. These include a higher dietary intake of carotenoids, vitamin E, vitamin C, and omega-3 fatty acids. It is also important to quit smoking. Reduce or quit alcohol intake. Ensure your blood sugar levels and blood pressure is well controlled. In addition, the use of sunglasses helps to block off ultraviolet rays from the sun, thereby preventing direct exposure of the eyes to these rays. Lastly, regular eye checks are beneficial in early detection of these cataracts. If, however, you have developed a cataract, a surgical procedure can be done to replace your clouded lens with a clear, plastic, intraocular lens.
Okay.
A few other conditions affecting the crystalline lens include the following. Presbyopia. This refers to the gradual loss of the eye's ability to focus on near objects. It is a natural process that results from a decrease in the elasticity of the lens, which is often noticeable after the age of 40. Although this aging process can't be reversed or halted, it can be corrected via the use of corrective eyeglasses, contact lenses or surgery. Ectopia lentis. This refers to the dislocation or displacement of the natural crystalline lens from its normal position. It is usually associated with trauma to the eye. However, it may be associated with ocular or systemic diseases. Additionally, ectopia lentis can cause major refractive shifts, pupillary block, glaucoma, retinal damage, and blindness. Aphakia. This is the absence of the natural crystalline lens from the eye. It is usually caused by injury to the eye, certain eye surgeries, or could occur from birth. It often causes blurred vision, difficulty focusing near or far objects, and faded color vision. Treatment for aphakia is usually by surgically implanting an artificial lens into the eye. Contact lenses may be prescribed for children too young to undergo definitive eye surgery. Alright, let's talk about the vitreous body.
Yeah.
The vitreous body, also known as the vitreous humor, is the clear transparent fluid that fills the space between the lens and the retina. 99% of this fluid consists of water. The rest is a mixture of collagen, proteins, salts and sugars. Despite its water-to-collagen ratio, the vitreous has a firm jelly-like consistency. The vitreous performs a vital role in protecting the eye. Most importantly, it helps to hold the eye's spherical shape. In addition, the pressure of the vitreous humor helps to keep the retina in place. In the normal eyes, the vitreous is attached to the surface of the retina through millions of tiny, intertwined fibers. However, as we age, the vitreous shrinks and these fibers pull on the retina's surface. If these fibers break, the vitreous shrinks further and ultimately gets separated from the retina. This results in a condition called a vitreous detachment. It is a common condition that usually affects people over the age of 50. It is also more likely to happen in individuals who have suffered from short-sightedness, have had an eye injury, or have experienced uveitis.
So, what are the symptoms of a vitreous detachment?
The major symptom is the presence of floaters. Now, as the vitreous shrinks, it becomes stringy. These stringy entities float around the rest of the vitreous body, casting shadows on the retina. These are called floaters, which appear like specks, strings, or cobwebs in one's field of vision. A vitreous detachment doesn't harm vision on its own. However, in some cases, the fibers can pull so hard on the retina that they create a macular hole or a retinal tear that leads to a retinal detachment. Without treatment, a macular hole or detached retina can lead to permanent loss of vision in the affected eye. Hence, if you start to notice any of the earlier mentioned symptoms, it is very important you see your eye physician right away. Another condition that affects the vitreous body is called vitreous hemorrhage. This occurs when blood leaks into the vitreous humor from blood vessels located at the back of the eye. Causes include vitreous detachment, trauma to the eye, poorly controlled diabetes, etc. Vitreous hemorrhage results in vision impairment ranging from a few floaters to cloudiness, hazy vision, and complete loss of vision. Vitrectomy is a surgical removal of the vitreous which is sometimes required in the management of severe vitreous detachment, vitreous hemorrhage, retinal detachment, macular hole, etc.
Wow.
Lastly, we'll look at the retina a little closely. The retina is a thin layer of tissue that lines the back of the eye on the inside. The function of the retina is to receive light that the lens has focused, convert these light rays into neural signals, and send these signals to the brain for visual recognition. It is composed of different layers of cells, one of which are light-sensitive cells called photoreceptor cells. The photoreceptor cells primarily consist of the rods and the cones. The rod photoreceptors detect motion, provide black and white vision and function well in dim light. The cones on the other hand are responsible for central vision and color vision. They perform best in medium and bright light. The rods are located throughout the retina. The cones are however concentrated in a small central area of the retina called the macula. At the center of the macula is a small depression called the fovea which contains only cone photoreceptors, and is the point in the retina that is responsible for maximum visual acuity and color vision. The photoreceptor cells take light focused by the cornea and lens, converts it into chemical and nervous signals, which are transported to the visual cortex of the brain by way of the optic nerve. These signals are converted into images and visual perceptions in the visual cortex of the brain where objects are identified as what they really are. There is a wide variety of retina-related problems. Let's start with macular degeneration. It is also known as age-related macular degeneration. It is a condition that refers to a gradual wearing out of the macula. Affected patients gradually lose central vision, but peripheral or side vision is preserved. However, blindness rarely occurs. The occurrence of macular degeneration increases with age. It may also affect one or both eyes. Early signs of vision loss include shadowy areas in one's central vision, or unusually fuzzy, wavy or distorted vision. Additional symptoms include difficulty seeing details in poor lighting conditions, and glare sensitivity. Though macular degeneration is associated with aging, research suggests that there may also be a genetic component to the disease. Risk factors for developing macular degeneration includes a positive family history, smoking, obesity, high cholesterol levels, and high blood pressure. There is no cure for macular degeneration. There are however some treatment modalities that may delay its progression and improve vision. This is made more effective by early detection through comprehensive routine eye examinations, especially in people above 65 years of age. Diabetic retinopathy. This is one of the devastating complications of diabetes mellitus in which there is damage to the blood vessels that supply and nourish the retina, leading to significant loss of vision. Prevention includes adequate control of blood sugar levels and routine eye exams. Hypertensive retinopathy. Chronic uncontrolled high blood pressure can also damage the tiny blood vessels that nourish the retina, leading to significant vision problems. Routine blood pressure monitoring and treatment of high blood pressure will prevent the development of hypertensive retinopathy. Solar retinopathy. This refers to photochemical toxicity and resultant retinal injury as a result of sun gazing or eclipse viewing by an unshielded eye. It often results in mild to moderate visual acuity deficits. There is no known treatment for this condition. Some people may recover spontaneously after about 3 to 6 months. Direct sun gazing or eclipse viewing should be avoided to prevent solar retinopathy. Retinal detachment. This is an emergency situation in which the retina becomes separated from its underlying supportive tissue. Retinal detachment deprives the retinal cells from the layer of blood vessels that supply oxygen and other nutrients. Hence, the longer the retina stays detached, the greater the risk of a permanent vision loss in the affected eye. If suddenly, you notice spots, floaters, or flashes of light in your field of vision, you might be experiencing the warning signs of a detached retina. Your vision may become blurry, reduced, or you might see a descending curtain or shadow from the top of your eye. Usually, no pain is associated with retinal detachment. Risk factors include aging, previous history or family history of retinal detachment, external injury to the eye, or extreme nearsightedness. Rarely, complications of eye surgeries, tumors, diabetes and sickle cell disease may be associated with retinal detachment. Treatment options for repair of retinal detachment includes cryopexy, laser surgery, scleral buckling surgery, vitrectomy, pneumatic retinopexy, etc. In conclusion, early diagnosis of a retinal detachment is key to preserving vision. And this is only made possible by routine eye exams and early presentation to your eye physician once any abnormal eye symptom is noticed.
Thanks, Dr. Losig. It's been a long, but very educative session.
You're most welcome, Dr. Mercy.
There are indeed many people all around the world who are suffering from one eye condition or the other. And of course, many are blind. Despite the technological advances in the medical world, many are still blind, or worse still cannot afford appropriate eye treatment.
Jesus, the great eye physician, has the ability to restore your sight if you are in this category.
Yeah, he did a similar miracle for a man who was born blind many years ago.
And of course, he has restored the sight of so many people afterwards.
His consultation hours are round the clock, anytime, anywhere.
For a start, however, he desires to establish a doctor-patient relationship with you first.
Yeah,
And you have to initiate this relationship by opening your heart to him.
exactly. To have him take ownership of every area of your life.
Once this relationship is established, then he has unrestricted access to heal and restore every part of your eye that is diseased.
Of course, he's very eager to be your physician today. Thanks for having us on your screen, lovely viewers. Hope to see you next time.
Bye everyone.